Hello, thank you very much for joining me today. My name is Alexa Chai. I'm a urologist at St. Jude Medical Center in Fulton, California. Today, I'm going to talk about overactive bladder with urinary incontinence. Let's start with a case presentation. Mrs. AS is a 61-year-old female who presents to the urology office concerned about worsening urinary frequency and urgency. She reports that she leaks urine before getting to restroom. She wears about 3 pads per day. She voids 8 times during the daytime and 3 times at night. She has started bathroom mapping and gets anxious going to new places. She now wears thick, dark pants because she fears that she's gonna leak in public. She drinks 2 cups of coffee, 64 ounces of water a day. Her past medical history include hypertension. Her family history is significant for her mother has recurrent bladder infections and overactive bladder. She is very pleasant retired teacher. She smokes about little less than half pack per day. Overactive bladder is defined as urinary urgency with or without urinary incontinence in the absence of urinary tract infection or other obvious pathology. It is very common. It affects about 1 in 4 women. It's a condition that is very inconvenient, can be embarrassing, and sometimes debilitating. Pathophysiology is still not completely understood. Urinary urgency is a condition with a complaint of sudden compelling desire to pass urine, which is difficult to delay. It is quite distinct from normal urge. Urge urinary incontinence, involuntary loss of urine associated with urgency. I leak if I don't get to the restroom fast enough. The study shows there is increased risk of urinary symptoms in persons with female family members who also have overactive bladder symptoms. What is bladder? Bladder is a round bag-like organ that stores urine until enough urine accumulates for removal. It is able to hold up to 2 cups of urine. Average, we will urinate about 1,500 to 2,000 milliliter. Therefore, the average voiding times will be 5 to 6 times a day. Overactive bladder interrupts the normal storage of urine. It causes the bladder muscle to suddenly squeeze before the bladder is full. Therefore, in patients with overactive bladder, will experience significant urge when the bladder is only 1/3 full, urinate more than 8 times a day, leak anywhere from few drops to entire contents of the bladder. So when you come to urology office, we will be performing these exams. First, we check your urine. Urinalysis is to rule out urinary tract infection and blood in the urine. Bladder scan is a quick ultrasound exam to see how much urine is left in your bladder after urination. This is to rule out urinary obstruction, neurogenic bladder. Bladder diary. Sometimes I ask my patients to fill out bladder diary to document intake and voiding, time, volume, symptoms, and sleep schedule. Physical examination is very important. We assess for pelvic floor muscle tone, reflexes, skin integrity. Cystoscopy, urodynamic study, renal ultrasound. These studies will be performed if the patients fail first or second line therapies, if there is any suspicion for neurogenic bladder, complicated overactive bladder symptoms, recurrent bladder infections, blood in the urine, or the patient has history of urological or pelvic surgeries. Underlying urologic conditions resulting in lower urinary tract symptoms must be considered before making a diagnosis of overactive bladder. Common causes may include urinary tract infection, malignancy, urinary stones, pelvic floor muscle dysfunction, diabetes, polydipsia, which is drinking too much water, neurogenic bladder, interstitial cystitis, bladder pain syndrome. My daughter drew this picture for my presentation. Overactive bladder should be treated as means of improving quality of life. You may be seeking evaluation of the symptoms in order to rule out life-threatening condition. Once the appropriate evaluation is done, comorbid conditions are excluded, then it is reasonable for you to opt out of treatment. Let's now talk about treatment options. The first line treatments are behavior therapies, which should be offered to all patients. Fluid management and diet modification, bladder control strategies, urgency suppression, pelvic floor muscle training with or without biofeedback techniques. Ideal consumption will be about 50 ounces, 6 to 7 cups of water a day. Remember, not all liquids that enter your body are through drinking. Many foods contain liquid too. Not drinking enough fluid will result in more concentrated, dark yellow, strong smelling urine that can irritate the lining of the bladder. In the end, you may actually end up needing to go to the restroom more frequently. Drinking too much. If you drink about a gallon a day, you will urinate multiple times a day. Diet modification. Some foods and drinks can irritate the bladder and make problems worse. Try to avoid alcoholic drinks, caffeinated foods and drinks, such as soft drinks, coffee, tea, chocolate, and energy drinks. Tomato-based foods, spicy foods, artificial sweeteners. Last week, a very pleasant patient came to my office with overactive bladder symptoms. She tells me she drinks 3 cups of coffee and she sips iced tea all throughout the day. I had to negotiate with the patient to drink only 1 cup of coffee, 1 cup of tea, and 4 cups of water. We'll see if this change will improve her symptoms. Constipation can sometimes make bladder problems worse. Large hard stools puts pressure on the bladder, decreasing its ability to hold urine or obstruct the flow. Keeping healthy bowel movement habits will help you avoid constipation and may lessen bladder problems. Please eat food high in fiber and exercise. Being overweight. Excess weight puts pressure on your bladder and pelvic floor, which will irritate the bladder and cause bladder leaks. If you're overweight, even 5% weight loss can greatly lessen bladder problems. Cigarette smoking can irritate the bladder and also cause you to have bouts of strong cough. Both can cause bladder leaks. If you stop smoking, you reduce bladder problems and also enjoy other health benefits. Bladder training. I ask my patients to follow timed and double voiding. The goal is to void every 3 hours during the daytime, not every 20 minutes to 1 hour. So what can you do when you experience such an urge to urinate just after only 30 minutes after you just went to the restroom? So urge suppression. First, you want to relax your abdominal muscle by taking 5 to 10 slow, deep breaths. Then quickly squeeze pelvic floor muscles 5 to 10 times in a row. Distract yourself from urge. Check your emails. Go over to-do lists. Whose birthday is coming up? Then pace yourself. Once the urge has decreased, walk slowly to the restroom or try to hold off another 5 minutes. What about nighttime when you experience urgency during sleep? When you wake up with urge, try using tests that work best for you for two minutes. Squeezing the muscle for 2 minutes. If the urge does not go away after 2 minutes, go ahead to the restroom and then return to sleep. This is a comic strip drawn by my daughter. This lady is on a date and she really needs to use a restroom. So she's telling herself to squeeze my muscles. So what muscles do we need to squeeze? Finding your pelvic floor muscles. Think about muscles you will use to control the passing of gas or to hold back bowel movement. Squeeze the ring of muscles around your rectum as you would in those situations. When you squeeze these muscles, you should feel tightening or pulling in of your vagina. Think about drawing your pelvic floor up and inward. Tighten your pelvic floor muscles, hold them for 3 or more seconds, then completely relax your muscles. Do this 15 times in a row, 3 times a day. For example, do 15 contractions before breakfast, 15 contractions after lunch, and 15 contractions after dinner. Remember to breathe during exercise. Pelvic floor physical therapy is provided by physical therapists, involves training the pelvic floor muscles to improve function. This includes massage or stretching of the muscles to improve tone and pelvic alignment. Biofeedback. Small sensors are placed in the vagina and on the abdomen. When you tighten the right muscles, the machine will give you feedback by changing lights or sudden sounds on this computer screen. Back to the case. So patient comes back and she reports changing her diet. She stops cigarette smoking. She also has undergone physical therapy and reports having significant improvement in her urinary frequency and incontinence. She is very happy. But 1 year later, she presents with worsening urinary incontinence. She admits that she has gained more weight and has not been doing pelvic floor exercises. She is frustrated and would like to try new medication. Several medications are available to help treat overactive bladder symptoms. There are 2 classes of medication. First one is Antimuscarinics. There are 6 different kinds of medication in this group. No one drug is right for everyone, and each has advantages and disadvantages. It has very high efficacy, 55 to 80% reduction in urge urinary incontinence, and 30 to 50% reduction in urgency. We recommend adequate trial of medication. Adverse effects. As with almost all medication, there may be some unwanted side effects. The common side effects are dry mouth, constipation, cognitive decline, especially with oxybutynin. The medications are this type of medications are contraindicated if you have narrow angle glaucoma, and we want to use with extreme caution if you have a history of impaired gastric emptying, history of urinary retention, not able to urinate, and history of dementia or cognitive impairment. Other class is Beta3 Agonists. Myrbetriq. This medication relaxes your bladder muscles so it can hold more urine. It has less side effects than previous medications. This medication may increase your blood pressure. It can cause hypertension and nasal congestion. It is contraindicated in patients with uncontrolled hypertension. Gemtesa is a brand new medication. FDA has just approved the medication. It has no significant impact on the blood pressure, and it can be crushed. However, since it's new, the price could be unreasonable for some patients. Combination therapy. For certain patients with severe overactive bladder symptoms, sometimes I prescribe 2 medications, Myrbetriq with Vesicare. Studies show that combination therapy significantly improves the symptoms compared to single therapy. There is no increase in adverse events with combination therapy. So let's go back to our case. The patient has been taking Myrbetriq 50 milligrams a day and has been experiencing significant improvement in her lower urinary tract symptoms. She had a phone call with her best friend, who also has overactive bladder with urinary incontinence, and her friend underwent a urology procedure, which has greatly helped her symptoms. So my patient would like to know about other options. Tertiary options are Botox bladder injection PTNS, sacral neuromodulation. First option is Botox bladder injection. Botox is injected into the bladder muscle through cystoscope using an injection needle. The patients report 75% reduction in urinary incontinence. It is very quick, easy procedure. It takes about 5 minutes that can be performed in the office. The treatment lasts up to 6 months to 1 year. Complication could be bladder infection, urinary retention. To prevent infection, I give antibiotics before and after the procedure. Only about 6% of the patients will develop urinary retention, and you need to learn to perform catheterization for a short period of time. Other option is PTNS, peripheral tibial nerve stimulation. This technique comes from traditional Chinese medicine. It is very much like acupuncture. Each session is 30 minutes long. You're scheduled once weekly for 12 weeks. And then if you're having good improvements, you'll be scheduled for maintenance therapy monthly. 55% to 70% of patients report improvement. It has better efficacy if it's combined with medications. However, it requires travel and frequent office visits. It is contraindicated in patients with cardiac pacemakers, defibrillator, pregnancy, those seeking pregnancy, or patients with nerve damage. Sacral neuromodulation. Permanent electrode is placed adjacent to the sacral nerve roots. This provides gentle nerve stimulation to correct the bladder-brain communication pathway and restore bladder function. Stimulation will feel like slight pulling and fluttering sensation in the pelvic area. The patients reported 84% satisfaction and 81% reduction for incontinence. Trial of therapy will be first done in the office under local anesthesia. A thin wire is inserted in the upper part of the buttocks and connected to the device. If you experience significant improvement, the permanent device will be installed under sedation. Fourth line treatment will be indwelling catheters. This is last resort in selected patients. Augmentation cystoplasty or urinary diversion. We create new bladder with part of your intestine. And these surgeries are only for severe refractory complicated overactive bladder patients. So you are not alone. Many women, up to 17% of population, experience overactive bladder symptoms. It is important to rule out underlying disease, which can cause lower urinary tract symptoms. Appropriate urological evaluation is recommended, and targeted treatment plans can be developed and outcomes optimized. So let's go over some questions. How long does it take for behavior therapies to work? Change to bladder control will be gradual. It will take time, practice, and patience to build your skills. Most patients notice positive changes within 3 months, and some may take more to see the full effects. How long does it take for the medication to work? The medication will take its full effect after 1 month of taking the medication. Can the therapies are combined? The studies show that when drug and behavior interventions are combined, they have a greater potential to enhance outcome than could be achieved by either therapy alone. What if you get sacral neuromodulation, it stops working? Your provider, your doctor, and company representative will check the integrity of device and reprogram the settings. Thank you so much for attending this presentation.